So next is V13, gynecomastia. So what is gynecomastia? It's a hyperplasia of the stromal or the glandular ductal tissue of the male breast. Presents as a concentric painful swelling due to altered estrogen-androgen balance in favor of estrogen or increased breast sensitivity to the normal circulatory levels of the estrogen. So common benign unilateral, bilateral, usually reversible. How do men produce estrogen? So mainly through the peripheral conversion of androgens to the estradiol and estrone by the aromatase enzyme and small amount from the testicular secretion. What are the causes of gynecomastia? So it's divided into physiological, pathological and pharmacological. So physiological, newborn infants, pubescent, adolescent and elderly individuals. Elderly gynecomastia due to increased aromatization of testosterone and gradual decrease of the testosterone production in the aging testes. And pathological, increase in the production action of the estrogen due to liver disease, due to lung cancer and due to testicular cancers. And decrease in the production of testosterone due to Klinefelter syndrome, bilateral cryptorchidism, hyperprolactinemia, renal failure and testicular feminization. Increased aromatization of the testosterone. And pharmacological include a lot of medicine like antiandrogens, finasteride, very commonly used in the prostate cancer patients, chemotherapy drugs like methotrexate, vinclozine, and alkylating agents, hormones like anabolic steroid for the gym, building up the muscles. Recreational drugs include alcohol, cannabis, heroin, and methadone. Cardiovascular drugs, calcineurin blockers, ACE inhibitors, digoxin, spironolactone, and amiodarone. So remember, ACE inhibitors, calcineurin blockers, spironolactone, digoxin, antibiotics, metronidazole, minocycline, isoniazid and ketoconazole, psychiatric agents, diazepam, haloperidol, tricyclic antidepressants, omeprazole, metoclopramide, phenytoin, theophylline, and methotrexate. How would you investigate a patient with a gynecomastia? Take a history, age of onset, recent changes in the nipple size, nipple pain and discharge, history of testicular trauma, mumps, drugs use, family history, sexual dysfunction, infertility, hypogonadism like impotence, decrease in libido and strength. Examine the patient breasts, abdomen, testes and signs of feminization. If rapidly growing gynecomastia outside of follicular stage, then we should do some blood tests including LFTs, UNEs, prolactin, beta-HCG, LH, estradiol and total testosterone. Chest X-ray, triple assessment if indeterminately is found. How would you treat the gynecomastia? So if it's physiological, reassure like newborn, elderly gynecomastia. Other is pubertal gynecomastia resolved within 3 years in 90% of the patients. And pharmacological, withdraw the medicines. Hypogonadism, give some testosterone. Idiopathic gynecomastia or residual gynecomastia after the treatment of primary cause, weight loss, then consider medical therapy or surgery. Medication is unlikely to work if gynecomastia present for more than 1 year. Tamoxifen is effective and up to 80% of the patient report partial to complete resolution but not currently licensed for use. Then is the danazol. If someone is producing too much LH, FSH, it decreases, it inhibits the LH, FSH, which decreases estrogen production from the testicle. And the last but not the least, so after physiological, pharmacological, hypogonadism, idiopathic, breast surgery is the last option in which we do liposuction or reduction mammoplasty, not routinely funded. Complications include contour irregularity, scarring, skin necrosis, asymmetry, inverted nipple, and permanent nipple numbness.